Greetings and good afternoon. Today is a significant day as we continue to show our support and commitment to effectively reduce the burden of cancer, as it remains the third leading cause of death in Fiji, so one of the highest causes of death in Fiji. On the 26th of November 2015, the Ministry of Health and Medical Services became a member of the Union for International Cancer Control, showing commitment and partnership in the global fight against cancer. The World Cancer Declaration calls upon government leaders and health policy makers to significantly reduce the global cancer burden, including integrating cancer control into the World Health and Development Agenda. And it is truly a global fight. To date, 533,477 people around the world have signed this ambitious declaration. Fiji has already made several commitments to reducing the burden of cancer, such as through the World Health Assembly resolutions. Currently, in our country, approximately 1,300 people are diagnosed with cancer every year. Most of this is to do with breast, cervix, colon, uterus, and liver, and approximately 41%, around 533, will actually pass away from the disease. Some of these cancers are curable, either in Fiji or abroad, and all of them are treatable. As I mentioned earlier, cancer is the third leading cause of death in Fiji and takes more than 60% of the money that we allocate for patients to be referred overseas. So 60% of the patients are for cancer cases. By fulfilling the targets, Fiji will be able to provide comprehensive cancer treatment without the need to travel overseas. By 2025, Fiji will improve access to accurate cancer diagnosis, quality multimodal treatment, rehabilitation, supportive and palliative care services. Ladies and gentlemen, I encourage all Fijians to get screened because early detection is the best prevention. July also marks NCD month, and the escalating prevalence of NCD in Fiji raises concerns, as these diseases, which include heart problems, strokes, and diabetes, contribute to almost 80% of all deaths. I hope all of us in this room have already been screened this month, so we make sure that we know our status, what our status is, so we can do something about it. I encourage us all to eat more fresh foods and less processed foods, or the one in the lovely packaging. Don't eat that lovely packaging. Lovely on the outside, lethal inside. And engage in more physical activity, or put simply, move more, whether it's exercise or just dancing to the swaying of the palm leaves or whatever. Move more. Our health and well-being is our responsibility, prime responsibility of every single person. And we must take full ownership of this to live a productive life. Throughout the month of July, the Health Ministry will continue to remind the public on the importance of getting screened to know their health status. Ladies and gentlemen, I also wish to thank the Fiji Cancer Society, WOW's Kids Fiji, and Tano Hotel, SUA, for supporting, advocating, and assisting those people living with cancer in Fiji. It is your support and commitment that helps us keep fighting the good fight, the fight against cancer, the fight for a healthy Fiji. In conclusion, through this declaration, the Ministry, the Union for International Cancer Control, Fiji Cancer Society, and WOW's Kids commit to helping Fijians have cancer detected early by dispelling myths and misconceptions about the disease and reducing stigma which discourages people from visiting clinics. With these words, ladies and gentlemen, I thank you all for being present here today to witness this occasion, and I wish you all a splendid evening. Much